Disruption of the vascular and lymphatic system has severe and sometimes debilitating implications for the patient. The Hydroven 12 intermittent pneumatic compression system from Huntley is a powerful 12-chamber system designed specifically for the management and treatment of lymphatic and vascular disorders. IPC is a clinically proven modality used either as a standalone treatment or as an adjunctive support therapy. Hydroven 12 is unique in the way it offers clinicians a choice of 3 different treatment profiles. These are sequential, wave, and the patented lymphocyst modes. Both sequential and wave modes are used in the treatment of edema and general wound care environments. The patented lymphocyst mode, developed with assistance from lymphedema specialists and is designed specifically to target lymphatic disorders. The following animations and supporting explanations will provide you with an understanding of the 3 different treatment profiles. All Hydroven 12 garments are manufactured from soft, durable materials with patient comfort in mind. Hydroven's unique overlapping chamber construction allows compression to be delivered around the complete circumference of the limbs, making them more effective and comfortable for the patient. In the following illustrations, the patient is wearing a full-length 12-chamber leg garment. The same principles apply to either arm or leg garments. Sequential mode. The sequential mode is the simplest of all 3 modes. With the patient wearing a suitably sized 12-chamber garment, the garment will always inflate in a distal to proximal direction. Chamber number 1 is at the foot or hand, whilst chamber number 12 is positioned at the upper thigh or shoulder. Having pressed the Run standby button, the system will initialize and begin the following sequence. Chamber number 1 gently inflates to the required target pressure. In this example, the user has set a target pressure of 40 mm mercury. On reaching the target pressure, the pressure in chamber number 1 is held and chamber number 2 begins to inflate. As chamber number 2 inflates, you will notice that it inflates to a target pressure, which is slightly less than the 40 mm mercury pressure setting in the previous chamber, chamber number 1. This sequence is repeated for all remaining chambers, a total of 12 chambers. The pressure in all 12 chambers is held for a period which is set by the user. Once this period has elapsed, the system deflates all chambers simultaneously. A key feature of the sequential mode is that it delivers a clinically significant 40% pressure gradient across all 12 chambers, distal to proximal. Wave mode. Wave mode is often referred to as peristaltic mode. Having pressed the Run standby button, the system will initialize and begin the following sequence. Chamber number 1 begins to inflate. As it reaches its target pressure, 40 mm of mercury, the second chamber begins to inflate. When the second chamber has reached its pressure, chamber number 1 begins to deflate and chamber number 3 begins to inflate. This sequence is repeated for all 12 chambers. This cyclical inflate-deflate action delivers the peristaltic wave action. You will observe the actual pressure in each chamber is less than the pressure in the preceding chamber, which ultimately delivers the 40% pressure gradient across the limb. Lymphocyst mode. The lymphocyst mode is a specialized gentle type of massage, which has been developed around a unique pattern. It is based on the Ludic manual lymph drainage sequence and aims to move the buildup of lymph away from swollen areas via stimulation, so it can drain through the patient's normal channels. The lymphocyst mode is a combination of 3 different patterns: peristaltic waves, lymphocyst pulses, and partial peristaltic waves. Having pressed the Run Standby button, the system will initialize and begin the following sequence. The lymphocyst therapy begins by delivering a single peristaltic wave to chamber 1 through to chamber 12. This light pressure has the effect of softening the surface tissue. After this initial phase, there is a short delay and the system delivers a set of 5 lymphocyst pulses to chamber number 12. Five identical pulses are then delivered to chamber number 11. After delivering the last pulse, a partial peristaltic pulse is applied back to chamber number 12. Then 5 lymphocyst pulses are delivered to chamber number 10. Then a partial peristaltic pulse is applied to chamber number 11 and 12 in sequence. This complete sequence is repeated for all chambers and takes approximately 15 minutes to deliver. Unlike the sequential and wave modes, lymphocyst does not produce a pressure gradient. To aid the understanding of this complex yet effective mode, you may wish to refer to the accompanying graphs. Also read the instructions for use before selecting a particular profile.